Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider, and I'm joined by my colleagues, my friends, two of my favorite people, Sara Fisher and my wife, Jenice Mattek. And I've asked them to come on and speak with you about training the female core. Because I just had a client, a brand new client, come into us, and she was referred by her personal trainer with low back pain. And her history was she actually had a hysterectomy. So she's a real fit, active woman, and she was having low back pain, and part of her history was she had a hysterectomy. And there's many women, just like my client Cheryl, that present with low back issues, chronic hip issues, even neck and shoulder issues related to how they're using their core and as it relates to their history of surgery, trauma, and even pregnancy. So thank you guys for joining us, and would you please introduce yourself and talk about your book that discusses actually surgery, pregnancy, and trauma.
Great, I'm Jenice Mattek, as Evan said, the director for the Institute of Integrative Health and Fitness Education.
And I'm Sara Fisher.
So actually we're going to talk about the book a little bit later, so Evan, was there anything else that you wanted to add before we go ahead and get started?
Absolutely not. So go ahead and get started.
Awesome.
Please.
We're going to get him out of the picture so he can focus more on us. And that's how Sara and I roll. So 2 questions Evan told you that we were going to discuss today. And the first one was, what do you need to know about working with your female clients post-surgery? And the number one thing you need to do is when you're going to work with your client post-surgery, you need to make sure that they have medical clearance, because they've had major surgery and maybe their doctor doesn't know exactly what they're going to be doing, but their doctor's going to tell them that they can return to their regular activities. And if you have a high endurance type athlete that you're going to start working with, the doctor needs to be clear about what their normal activities are. So that's the first thing you want to do when you start working with your clients post-surgery.
Right, and get that in writing, get the doctor's approval.
Yes, absolutely. So the other thing that's really important when you start to work with your clients post-surgery, and one thing we want to understand is that when Sara and I think about working with our clients post-surgery, and we talk about this in our book, is post-surgery can be, depending on their doctor's clearance, can be immediately post-surgery to 60 years post-surgery, because those are the types of clients that we see. So one of the areas that really goes under-addressed is the deep core. So I'm going to let Sara talk to you guys about what we mean by the deep core and why it's so important that we start to address the deep core.
Right, so the deep core includes muscles like your pelvic floor, your diaphragm, your psoas, your multifidi, all those local muscles that surround the joints, not necessarily including the superficial core, like the rectus abdominis, the obliques, the lats, some of the hip muscles. So we want to make sure that we're getting that deep core turned on and participating before the superficial kicks in, because that's what the superficial will actually come in to do, is start to grip and hold down and protect, because after surgery, it's essentially a trauma. And so your body is going to protect and to guard. So we have to then retrain and say, okay, hey, the superficial muscles need to settle down. Let's bring the deep muscles back online.
So that becomes important because when your client has had surgery and there's trauma, just like any other injury to their body, the first thing that body wants to do is protect the space. And so the area that's protected is the abdominal area. And the key muscles that are going to do that are those larger, more superficial muscles. So like Sara said, your obliques, the rectus, your lats, the erectors, all of those muscles are going to just squeeze down, clamp down, and create security the best way the body knows how to do that. And if you're wondering what that might feel like, if you've ever sprained or strained a muscle, you get that automatic stiffness that starts to happen around the joint. It's that same idea. Your muscles start to just tighten down and secure the space. Much like a mother bear who brings her cubs in to keep them safe. She tucks them in tight to keep them safe. Your body does that exact same thing, especially when it's post-surgery. So our job then as a fitness professional is to understand what that deep core is, what the deep core does, and how do we then help our clients access that. And the number one thing that we talk about in our book, and the number one thing we do with each one of our clients post-surgery, is we work on reestablishing their ability to have 3-dimensional breathing. Post-surgery, your breathing is interrupted from the anesthesia and other things that they provide to you during surgery. If you have a minimally invasive surgery, they actually put air in your stomach, so this changes your ability to access your 3-dimensional breathing. And given the fascial connections of our diaphragm to the muscles that Sara mentioned, the psoas, the multifidi, the pelvic floor. That allows, and the transverse abdominis or internal corset, that allows you as a fitness professional to then address that deeper system and help your clients reestablish and create that endurance, which is really the hardest thing, the endurance of that deeper system. So, did we adequately answer that first question, Sara?
I believe so.
Dr. Osar, we're looking at you. Can you give us a thumbs up if we adequately, awesome. So Dr. Osar gave us the clearance that we adequately answered that first question that he wanted us to answer. So the second one is, what should you do or not do with your clients in core training, especially if they struggle with things like chronic tightness, that lower pooch, and low back pain? So this is a big one, yes, right? Because why do most clients want to do core training?
Well, they want to lose that pooch. They want to lose that post-baby belly. They want to lose that weight, essentially. They think that there's too much around their midsection.
Yep, it's that aesthetics. People are always thinking about how my abdominal, how do my abs look aesthetically? So one of the things we want to think about is, we think of traditional core exercises, what do they do to the body? And so I'm going to give you an example. So I recently had a female client come in, and she was struggling with things like low back pain and low back tightness, but she wanted, as part of her program, she was doing planks.
Right.
And so I had her show me how she did a plank, and she did it the way we normally see people doing it. She pulled her abs in, she pulled her glutes in, she pulled her shoulder blades down and back, she set herself up in this position. And that is not the way we teach people how to do planks.
Right.
Pure and simple. But I needed a way to show her how this plank was affecting her body. So the one thing we did was we assessed. So one key concept, though, that I kind of skipped over is, if your client has success with the exercise, that's a good exercise for them. However, if they don't have success with the exercise, then that's not a good exercise for them. And Sara, how do we determine if our client is successful?
Assessments.
Yes.
So you have to assess your clients, all right? So I'm sure several of you already have the assessments that you currently use. Well, this is how you start to determine whether your client is having success with that. So check their range of motion, check their balance, test their, if you do muscle testing, test their muscle tests. Make sure they're coming out successful. If they're not, then you know something in that exercise pattern is not going well for that client at this particular time, and you need to modify.
Yep, so that's exactly what I did with this client. I tested her before she showed me how she did her plank. So she did her plank for, I think I had her do 5 breaths. Do 5 breaths while you're holding that plank position. We assessed her range of motion of her shoulders before and after, as well as her full body rotation. And what we found out is, after she did 5 breaths of holding her plank in this position, the more traditional way that people are coached to do it, she had decreased range of motion in her internal rotation of her shoulders, and she had decreased her ability to actually rotate her body. So what we did then is I said, okay, I'm going to set you up in the way that we teach how to do a plank that looks very much traditionally like you might see a baby start to go up into a plank position, which we don't cue to hold the abs in or pull the abs in. We don't cue to pull the shoulder blades down and back. We don't cue to squeeze the shoulder blades. We actually just really cue to put you in a good position to help establish good position of your shoulder blades for stability. We teach a long spine position, and oftentimes you might see like the butt is up in the air a little bit because we don't have them squeeze that tush down. So again, I had her do just 5 breaths. We got done. Her range of motion had returned even a little bit better, as did her rotation. So she was really surprised by that. So that is how you can use assessments to determine if your core exercises are helping, or as we say, hindering your client's ability to actually move and feel better in their body.
That's right. And one of the common notes that clients will even tell us after doing an exercise in this manner is, well, that was harder than I thought it would be. So they're still getting the challenge that they're looking for, but it's just not in the way that they maybe originally thought.
Yeah, because when I had my client do 5 breaths of her plank in the position she was used to, she's like, well, I can do it for way longer.
Right.
Well, yeah, she could, because she was compensating and not using the right muscles for the activity at hand. So as soon as I had her lined up, using her ABCs, using her breathing, getting her shoulders in a good position, all of a sudden her body was trying to figure out how to hold this position without squeezing and pulling everything down, back in, whatever. So anyway, she was super surprised and super excited that we actually created a new challenge for her when it came to her core training. So it was definitely a win-win. And again, was only able to help her move to that because we had an assessment that showed her it actually improved technically her spinal and joint health.
That's right.
So, Dr. Osar, do we get a thumbs up on that one as well? Yes. So remember, the key to that one is, if your client has success with the exercise, success is meaning that they were able to improve or maintain the range of motion that they started with or the stability that they started with, then you're on the right track for that exercise for that particular client on that particular day.
That's right, because it can change from day to day. That's why it's really important to assess each and every time.
So we hope we gave you a couple of really quick takeaways. One, you want to help your clients restore their three-dimensional breathing so that you can help train that deeper system, that support system, when we talk about working with our clients post-abdominal surgery. And two, when you're thinking about doing core training, you want to make sure that you're using an assessment to judge your client's success with the exercise, and it will also help you modify the exercise, and your client will have a better understanding of why you want them to modify and start thinking about using their ABCs, because we understand swimming upstream against an industry that promotes a lot of ideas of squeeze, pull,
brace.
Use a lot to do a simple task. We understand that's really hard, but if you can give your client a kinesthetic feedback, a way to feel in their body how by making a small change to an exercise that they like to do can actually improve and help them reach their goals faster, you're going to be their #1 resource. So I hope we gave you those 2 takeaways, because with that, we want to invite you to 2 very special days that we are hosting in Chicago. And one of them is it's a 2-day course. You can come for 1 or both days. Day 1 is going to be about working with a female client post-abdominal surgery. And Sarah's going to show you right now the book that we wrote, which is called What Lies Beneath the Under-Realized Effects of Breast, Abdominal, and Pelvic Surgery. And we're going to talk about and go a little bit more in depth in this course. And we're actually going to give you a multi-phase system that you can take your clients through post-surgery. Do you want to add anything to that day, Sarah?
Nope, I think you pretty much covered it.
I'm going to add one other thing. We're going to teach them how to assess.
There you go.
We're going to start to introduce simple assessments that you can use with your clients if you work one-to-one or if you work in a group setting. If you're working with somebody who's truly post-surgery, ideally you want to be working one-on-one with them, because they require a lot of feedback from you, because they might not be able to feel what's happening, and you need to be the expert to tell them that they're on the right track and assure them when they can't necessarily start to feel what's happening immediately.
Right. It'll be really critical for getting them post-surgery to that next phase of what their doctor has potentially cleared them for regarding exercise.
Dr. Osar is giving me a little point at Sarah, because Sarah might have personal experience with this very thing.
I had a C-section almost 17 years ago, and it's actually how I started to get myself back on track. I was suffering from a lot of symptoms from low back, migraine type headaches, chronically tight neck and shoulders, pain basically every day, completely exhausted, barely able to take care of my kids, and it was either do or die, because I was not succeeding. And so I implemented these assessments, these corrective exercises, and really started to make a huge change. And it's the reason for my success, my longevity to this day.
And I want to add, Sarah, that, or I'll ask you a simple question.
Sure.
Sarah, did that happen right after you had that C-section?
No. It did not. The process started shortly after, but really truly when I started to reach my critical mass of my breaking point is when I started to see Dr. Osar and Jenice. And it actually took about 18 months of consistent work before things started to really snowball in the right direction. And I'm going to say a positive direction.
And you would say that you said your C-section was 17 years.
Yes.
Did you start doing this type of work 6 weeks after you had that
No,
C-section?
heck no. I went back to teaching dance at 3 weeks post.
So when would you say that you actually started using these techniques that we're going to talk about in class?
Yeah, these techniques that we talked about in class, or that we will talk about in class, I actually started, oh my gosh, it might have been when my kids were 8 and 4, maybe 7 and 3 years old. So it was a few years before I actually implemented this work.
A few years. She said a few years. However, it just tells you that this information works even if you are working with somebody who's had multiple surgeries. Sara was lucky enough to have a VBAC after her C-section, but again, there was still a lot of trauma to your body even with that. And so even if you're working with people who've had multiple surgeries, these techniques are going to work. And even if it has been a number of years post-surgery, what we're going to introduce to you and share with you is still going to have a huge impact on your clients, even if that surgery was years ago. So that is an insight into day one. It's just a 4-hour course on day one. Day two, we're actually going to go a little bit more in depth. We're talking about female fitness and the idea of reframing how we use core training in the idea of training for spine and joint health. Because oftentimes your clients are told by their doctors, their physical therapists, or you yourself have said this, we all have, is your core is weak, you need to make it stronger. And that's why our clients always come to us, even though their abs are pulled in and on, turned on 24/7, they've still been told that they are weak, and that's why they have low back pain. That's why they're struggling. And so they do more crunches, and they do more planks, and more Supermans, and more, but they still struggle.
Right. And case in point, I went back to dancing probably about 8 to 12 weeks post C-section. Like me actually dancing, not just teaching dance, I didn't have a weak core. I just didn't have a very good strategy.
Right, and that is really the key. We are going to teach you strategies to still use core training, but to use it in a way that truly does improve and create spine and joint health in your clients. And we're talking the spine and joint, all those joints of the spine, those segments of the spine, the hip joint. We're also going to say, or show you how it actually affects the shoulder and the neck as well. So in this day, we're going to take you through some basic functional anatomy as it relates to what we call the thoracolpelvic cylinder, and you're going to start using that term too, but it's essentially core training. So we're going to take you through that. We're also going to take you through corrective exercises, common releases that you're going to want to do with your clients to help them get better access to that core. And not just this superficial core, but that deep core as well. So you're going to hear, it's going to be carryover, and you're going to hear similar ideas from day one to day two. It's going to be carryover because it's important. You're still looking to establish good core function here, as well as good core and efficient function in day two. Now, in all honesty, and if Jill, who hosted us in April, is listening to this, Sara and I, the first time we did this course, we went through it really fast. You think you know how much time you have. And I remember it was literally right before lunch, and I'm looking at the handouts, and my eyes are getting bigger and bigger as I'm going through the handouts. And I said to Sara, I went up to the stage, I'm like, Sara, you need to stop talking because we're done with the course. We only had the hands-on portion left to do, and we still had 4 hours of the course to do. And one thing I truly enjoy about working with Sara is we work really well together, and we put together the most amazing program that got the best feedback because we knew there was so much more we could cover. Right. We just thought we weren't going to have enough time. So over lunch, we put together the best part of the program, I would say, from a hands-on standpoint, and we do what we call a side-by-side. And we're going to do that with you. So we take you through assessment, and then we have you do how we recommend that you do core exercise, and then we have you reassess, and then we have you do that same core exercise in the more traditional format, and then we have you reassess. And right now, I'm just picturing the faces of the people in the class, because they would find maybe they wanted to do a shoulder assessment. They found that that's what they most identified with. They felt a different amount of change in that, and they would do it the way we would recommend it. And they'd go and they're like, oh yeah, that feels so much better. And then
they went and did the traditional or conventional cueing for that same exercise. And they'd go, what? My arm doesn't go up as high.
Yeah.
Why?
And why is my arm changing when I was doing my core exercise? Right. And so really seeing the value and being able to show that to your clients, because it is a struggle when you ask your client to change something because you learned something that you know will help them, but asking them to make a change of something that they've done. I mean, I learned the same core exercises from the time I was 5 up until I was like 27. And so telling me 22 years later, and all my wisdom in my 20s, that I need to change something is going to be really hard sell. But if somebody was said, look how this affects you, look how it affects this problem that you already have, I might have been more likely to change what I was doing.
And then you relate it to their goal and say how this is affecting your goal, and they go, oh, okay.
Yes, so we're going to take you through all of that. We're going to take you through the most conventional core exercises. We're going to take you through different programs, and we're going to let you yourself feel the difference in your body by just making some minor tweaks and just a little bit of a mindset change about how we can truly, truly, truly affect the spine and joint health. We're doing core training using simple things like ABC. So we invite you to join us. So there's a few things. It's going to be September 12th is the deadline for the early bird special. And for early birds, you receive a copy of our book, What Lies Beneath. And if you sign up by September 12th, we're actually going to give you 2 copies, one for you and one to share with a client who you know has had abdominal surgery and would find good information in this book. And then after the course, we're actually going to give you 30 days free access to the Female Core 2.0, which is going to take everything we taught you in day 2 class and then give you more information. It just gives you an online referral source. And you'll have access to that for 30 days, and we'll give you a special price after the 30 days if you choose to purchase that. So
the course is actually October 11th and 12th.
That's the deadline. Yes,
that's the deadline.
Yes.
But the actual course is October 11th and 12th. October 11th is the post-abdominal surgery, and October 12th is the reframing of the female core.
And there are CEUs included for ACE, NASM, and AFA. There's 4 credit hours for day 1 and 7 credit hours for day 2. And we would love for you to join us. The space is limited. It's right here in our office in Chicago, so we are limited to just 12 people. And we invite you to come to Chicago, or if you're already in Chicago, come down the street or to our neighborhood and hang out with us for a day and a half. So actually Friday's going to be like 1 to 5. 1 to 5 is that, and then we're going to do, I think we go 8 to 5 or 8
that
to
sounds right.
something like that on Saturday. But all the information's on our website at iihfe.com. And we look forward to seeing you. If you have questions, give us a shout out here on Facebook, send us an email. We'd love to answer your questions. We'd love to help you have success with working with your clients post-surgery and help you create and help your clients reach the goals that they want in their lives. Thank you.
Thanks for joining us.